Umbilical hernia is a health condition where there is a defect in the abdominal wall and through which the intestine and the fats around the intestine, what we call omentum, they push through the defect and appears as a lump. It causes a variety of symptoms. It can be present in infants, it can be present in any age group. Actually, this is 3 times more common in women than men, and among the children, the ratio is equal. And also, it's noted to be very common in children of African descent. In here, it is worth mentioning there is another related hernia that occurs around the belly button. It's called paraumbilical hernia, and it is just a similar hernia which is just above or around the umbilicus. What causes umbilical hernia? I think I need to divide it into 2 groups, infants and adults. In infants, during birth, the mother and the baby is connected by umbilical cord for nutrition and carrying oxygen from mother to the baby. But after birth, this tube closes spontaneously, but if it persists and then it presents as an infantile or congenital umbilical hernia. Whereas in adult, this scar or the weakness may reopen due to increased raised pressure inside the tummy for strenuous activities or lifting heavy weights and for a variety of reasons. And then it presents as an acquired adult umbilical hernia. And the similar things happens in paraumbilical hernia. And the certain factors where the pressure inside your tummy can be increased, multiple pregnancy or there is ascites like excessive fluids inside your tummy due to liver conditions, or sometimes people have to have a tube in the belly button for peritoneal dialysis. These are some of the few conditions where there is a risk of getting umbilical hernia. Of course, the adult can develop an umbilical hernia as we see in babies. The principle is same, but the causes are slightly different. In babies, it's due to the persistence of the umbilical cord, which is the connections between the mother and the baby during birth. Whereas in adult, it is the weakness or the scar has reopened due to raised pressure inside the abdomen or the tummy. And also, the treatment is slightly different in infants as opposed to the adults. And also the timing of surgery is different in different age group. The symptoms of an umbilical hernia is more or less similar whether in infants or adults. Let's talk about the infant first. In infant, the mother notices a little lump at the belly button when the baby is crying or laughing, and sometimes they may be crying unnecessarily because of pain at the belly button. Whereas in adults, the symptoms may range from a discomfort around the belly button or pain around the belly button when lifting heavy weights and heavy objects. Also, they may notice a lump around the belly button, but to be honest, a lot of the people don't notice the lump at the belly button unless it is noticed by the general practitioner during a routine clinical examination. The diagnosis of umbilical hernia is quite simple during routine physical examination. You will see a lump at the belly button and you will detect that by impulse on cuffing, which is a test. If you put the hand over the belly button, when the patient coughs, you can feel an impulse. That's what we call impulse on cuffing. And when the patient lies down and relax, you can actually feel the defect. Sometimes you don't see a lump or you don't see a defect, then only you can diagnose this by an ultrasound examination or very rarely with a CT scan. The umbilical hernia can be treated in different ways. Open surgery, by keyhole surgery, what we call laparoscopic surgery, and conservative surgery. First of all, I wanted to emphasize in infants, this hernia usually closes by 18 months, and if the operation is needed, it should be done at the age around 4 years. That is the rule of thumb. In open surgery, you open up the hernia by making a small incision around the belly button, and you approach the hernia, reduce the content of the hernia, and then put a mesh which is like a plug to seal the hernia, and then they close it off. So this is from going outside to inwards, whereas in keyhole or laparoscopic surgery, you make the operation by making two small holes. You put a camera in, and the camera look from inside to outside the hole or the defect, and you reduce everything inside the hernia, and then you put a mesh at the back of the hole so that nothing goes in. And finally, there is a role of doing nothing here, what we call conservative treatment. When you've got a very high-risk patient and the hernia is not causing any symptoms, there is a role of doing nothing here other than conservative management, knowing there is a little risk of strangulations which should be explained to the patient.